मैं डॉक्टर रमेश चौधरी, सेक्रेटरी एनएनएफ राजपूताना। आज जयपुर शहर में सीके बिरला हॉस्पिटल में डॉक्टर जेपी दादीच सर, जो कि एनएनएफ इंडिया के फॉर्मर सेक्रेटरी थे, उनका एनएनएफ लेगेसी सीरीज में इंटरव्यू लेने के लिए यहाँ पे आया हूँ। सर का मैं हार्दिक स्वागत करता हूँ।
Namaskar, Dr. Ramesh, and I'm really happy for this interview, and I'm really thankful for the NNF leadership for this initiative, and I'm grateful that you could spare some time for this interview. I will be very happy to converse with you on NNF's past and NNF's work during my tenure, and even before that, how NNF was formed and what was the history and what were the initiatives. Thank you.
बिफोर वी प्रोसीड फॉरवर्ड, मैं डॉक्टर जेपी दादी सर के अपने करियर एजुकेशनल क्वालिफिकेशंस के बारे में ब्रीफली कुछ बताना चाहूँगा। सो सर डिड हर एमबीएस ग्रेजुएशन फ्रॉम बीकानेर मेडिकल कॉलेज इन 1984 एंड ही डिड हिज एमडी pediatrics in 1988 from the same medical college, SV Medical College, Bikaner. Afterwards, he went to short clinical attachment in pediatrics and neonatology at PGI-MER Chandigarh in 1991, and summer program in biostatics at Vellore in 1993, and he did his postgraduate diploma in developmental neurology in 2008 from the University of Kerala, Thiruvananthapuram. He did many trainings, especially integrated clinical skills training in ARI, diarrhea, newborn care and survival under Ministry of Health in 1993. Neonatal Advanced Life Support course in 1993 at the Lucknow. He did neonatal ventilation workshop from the PGMIR Chandigarh, and neonatal ventilation workshop again from the AIMS New Delhi in 1997, and neonatal ventilation workshops, retinopathy of premature workshop. Luckily, he was the first among the ROP workshop attendees in 1999, and he did his research methodology workshop in 2005, and FBNC trainings hold at Jaipur in 2009, and his career was remarkable since the beginning. So that was about the short introduction of Sir's legacy, and now I want to take the course forward.
Yeah.
Sir.
So thank you, Dr. Ramesh, for briefly telling about how my education went actually.
Sir.
And then I went for various trainings to strengthen my skills and knowledge. So that was a very remarkable period of my life, that I got trained in so many things, and could contribute to the newborn care programs and policies in our country.
So that was reflected in your total duration of career in NNF and afterwards?
Yes.
Sir. Yeah. तो सर, आपका बहुत शानदार करियर रहा, और हम आपसे ये सुनना चाहेंगे कि आपका करियर का शुरुआत से लेके अब तक की जो जर्नी थी, उसके बारे में आप कुछ हमें विस्तार से बताइए।
Yes. After completing my MD in pediatrics from the SV Medical College, Bikaner, as you told in the beginning, I had the good fortune of joining the Department of Pediatrics at the Sundarlal Jain Hospital, Delhi, as a senior resident under Dr. S.K. Bhargav sir, who was the head of department there. The department at that time was providing a level 2 neonatal care. And while I was working as a senior resident, I got the opportunity because department decided to upgrade its neonatal services, and Dr. Bhargav wanted me to go to PGI MER Chandigarh for a short-term clinical attachment course at the Department of Pediatrics to understand the essentials of neonatal intensive care, to learn various procedures, and to acquire skills for managing sick and small neonates. I worked there under the supervision of Professor Anil Narang. And soon after that, a major expansion of services happened in our unit with procurement of new equipments and addition of more diagnostic facilities. Over the years, neonatal unit at Sundarlal Jain Hospital expanded its facilities. It emerged as an important center for the newborn care services with lots of academic activities, teaching because we had a DNB program there,
Sir.
and research activities. I worked at SLGN Hospital for more than 2 decades, and during this period, I did several trainings and academic courses, including a course in epidemiology and biostatistics from CMC Vellore in '93, NILS faculty training by NNF at Lucknow in 1993, human lactation management course from BPNI in 1992, and a postgraduate diploma in developmental neurology from CDC and Kerala University, Trivandrum in 2008. And I also did a faculty training for facility-based newborn care in
This city only.
2009, yeah, in Jaipur itself. In between, while continuing my clinical work, I contributed to the work of an NGO Breastfeeding Promotion Network of India in different capacities.
Oh, great.
In January 2022, I came to Jaipur and joined the Fortis Escorts Hospital as the senior consultant in neonatology and pediatrics. I shifted to CK Birla Hospital's Rukmani Birla Hospital as the director of pediatrics and neonatology in March 2023, and since then I am working here. Yeah.
So that's a great journey, remarkable journey, and hope the same your expertise will help newborns in the Rajasthan as well. So, sir, in which year you hold the office, and with all whom presidents you worked with,
Yeah.
sir?
Yeah. I got introduced in the policy making process of NNF
Sir.
in 2001-2 when I joined as the joint secretary and treasurer. So I was on this post for 2 years.
Sir.
And after that, I became the secretary in 2003, and I was secretary in 2003-4. After 2004, I remained the EB member
Mhm.
for 2 years, 2005 and 6. And while I was the secretary, I had the good fortune of working in the supervision of the president, Dr. Amita Fernandez, and Dr. Satish Saluja was there as the joint secretary and treasurer to help me out in day-to-day work of NNF Secretariat. Yes.
Dr. Dadhich, sir, please tell us about major initiatives taken during your tenure in the NNF
Yeah.
with your team.
Yes. In NNF, we had and still we have a culture of taking collective decisions.
Yes, that we see all.
Yeah, and as I told you that I had very good guidance in Dr. guiding force in Dr. Amita Fernandez as the president,
Yes.
and a very good help in the form of Dr. Joint Secretary Dr. Satish Saluja. So we did a lot of good initiatives during our tenure. Um, I will list them out. The first and foremost, which I think is very, very important, was that we got a permanent NNF office.
Yes.
That was a fully furnished office space in the upmarket shopping area of Netaji Subhas Place in Delhi,
Yes.
and it was acquired in 2004. It was a major milestone in the history of NNF, as for
Sure.
the first time, NNF got a permanent address so necessary to project implementation, publications, communication, and whatnot. Then, before this, NNF Secretariat used to move with the new secretary every 2 years,
Yeah.
going to the place where hospital where that secretary used to work.
Yeah.
And it has its own inherent problems because every 2 years there used to be printing of new stationery, and then we need to go to the authorities again to give
Understand.
renewed permission for the unit
Yeah.
journal of NNF, etc. So that ended with the acquirement of new office. Then the second, we got an affiliation with the International Pediatric Association, IPA. NNF achieved this affiliation in 2004, which still continues. IPA made an exception for India, admitting NNF as an affiliate, as mostly they affiliate with only one organization from a country. And IAP was already there. The only other exception is Mexico, where there are two organizations having their affiliate. So this was a kind of achievement for the NNF to have affiliation with prestigious organization. Then number three, I can say that we successfully did a bid to host the sixth international neonatal nursing conference at New Delhi in 2007. We won this bid in 2004, and this conference was organized in New Delhi in 2007.
That's great.
Yeah, the we moved the application in 2004 to the Council of International Neonatal Nurses. They accepted it, and we successfully hosted this conference later on in 2007. Then NNF contributed to the development of WHO Southeast Asia Regional Strategic Framework. So there was a meeting in Bangkok, and myself and Dr. Fernandez represented India there. That framework was used by WHO to develop neonatal care programs in 11 countries of Southeast Asia. So that was a big work which we did. Then, first time there was a publication of a case study on NNF in Zapigo USA's compendium of case studies.
Okay.
So first time we recorded how NNF was formed, what were its objectives, what were its achievements, what are its plans, and what are the challenges, etc. So first time it was recorded and published.
Yes.
Um, the name of our this compendium was Advancing the Agenda of Newborn Health Policy and Programs in India,
Sir.
the role of a professional association.
Yeah.
So this was written jointly by me, Dr. Amida Fernandez, and Dr. Vinod Paul. Then for India itself,
Sir.
we developed a compendium on the past, present, and future of the newborn health in India.
Sir.
It was titled The State of India's Newborn Soil Report. This was done in collaboration with the Ministry of Health, Family Welfare, Government of India,
Sir.
and several other organizations like Saving Newborn Lives, SNL, Save the Children USA, UNICEF, World Bank, and WHO. The report was launched in New Delhi in November of 2004. Then NNF, it was a long-going project which was going on to develop NNF clinical protocol book. This was also achieved during our tenure. It had protocols for 62 neonatal conditions.
Okay.
Then one more thing which I want to tell you, which again big achievement, was that our journal, that was the Journal of Neonatology, which NNF published at that time and is still publishing. It was indexed in the MBES, that is Experta Medica database, and we submitted it. It was accepted, and from January 2005, the journal was indexed in the MBES. So till the time we were in the NNF office in 2003-4, there were very few centers which were providing DM neonatology course. Very few centers, and we did the advocacy with the MCI to allow these DM neonatology course in other institutions, because MCI's objection was that till the time the DM neonatology faculty is there, DM neonatology course cannot be started. But then with our advocacy, they actually relaxed the norms, and many other institutions where people who are basically doing neonatology, under them the DM neonatology course started. And then we continued our advocacy with the National Board of Education for initiating DNB neonatology, and many institutions then they started having this course. Then in the we contributed in national policy making program implementation on neonatal care. NNF contributed actively to the implementation of national child health programs like CSSM, Child Survival Safe Motherhood Program, the RCH1, RCH2, IMNCI, and NRHM.
Yes.
We had collaboration with many other organizations like IAP, FOXY, that was started during our tenure, and that again went very well. So all these things I could recollect that we could achieve during our tenure.
Sir.
Yeah.
So that's great. You and your team showed that collectively we can and collectively we will.
Yeah.
And I think the culture is still continuing, and the same culture
Yeah.
hope to continue with the next generations as well.
Yes. Yes.
Sir, thank you.
Yeah.
So collectively, जो विक्ट्री का पाथ होता है वो आप लोगों ने हमें बहुत अच्छी तरह से दिखाया, जो फ्यूचर जनरेशंस को भी एनलाइटन करता रहेगा।
हम्म।
सर आप हमें कुछ बताएं कि जिसमें मेजर इंटरनेशनल कोलैबोरेटिंग एजेंसीज से आपने कुछ एनएनएफ की पार्टनरशिप या कुछ और कुछ प्रोजेक्ट्स किए हों,
हाँ हाँ
उनके बारे में।
हाँ। Dr. Mesh, apart from doing collaborations with the government agencies, Ministry
सर।
of Health and Family Welfare particularly, and other organizations like IAP and FOXY, we also forged partnerships with many international agencies.
सर।
And I can name a few of them, like the Saving Newborn Lives, SNL,
यस।
the Saving Save the Children, USA,
या।
and this partnership was for advocacy, documentation, publication, things like that.
या।
Then we organized a major partners meet during the Newborn Week 2003 in Delhi, with participation of Minister of Health and Family Welfare, Government of India, Department of Post, Government of India, WHO, UNICEF, USAID, IAP, FOXY, BPNI, Care India, and many others. We had a partnership with the Academy of Pediatrics with the common objective to reduce the IMR, and we jointly worked on several areas, including joint certification of training in NALS, PALS, neonatal
वेंटिलेशन।
ventilation,
यस यस।
NICU monitoring, and IYCF. There was a statement to this effect, which was signed by both the President, Dr. M.K.C. Nair, and
ओके।
Dr. Fernandez. So
ओके।
that statement is still available.
या।
Then we jointly came together, NNF and IAP, for National Task Force on Protocols of Neonatal Care Units in 2006,
सर।
and later on joint implementation of the NRP program. And presently, as we have a collaboration, IAP and NNF, that we are implementing the NRP program
एनआरपी। यस।
collectively. Then NNF collaborated with the Federation of Asia and Oceania Perinatal Societies, that is FAOPS, and ISOPAP, the Indian organization, and organized workshops. Particularly, one workshop I would like to mention, that is neuroprotective strategies for fetus and newborns at Patna in 2003. So these were all collaborations which we could uh, establish and used for betterment of newborn care, newborn health in our country.
So all your journey seems like all glorified, everywhere it's bloomings. But could you tell us any hurdles, challenges you or your team faced in particular during your tenure while achieving these so many
Yeah, yeah.
achievements?
I think there were many challenges, but the one which I would like to tell you was paucity of funds.
So that's still there
Yeah,
and
that's
will
still there. Yeah,
be.
still there,
Yeah.
but now a little bit better off.
Yeah.
NNF had very little source of income at that time.
Yeah.
The only major source was coming from the annual convention,
So,
and the organizing committee of convention used to transfer some amount of money
yeah.
to us from their profits. Um, Most of the people who were working with the office or the office bearers and all other people, they were working voluntarily for NNF
Yes.
at their own
Selflessly.
levels, yeah, and selflessly working. Later on, we got some projects from
Yes.
UNICEF and Government
Yes.
of India, and situation changed a little bit,
Hmm.
but finances remained a very strong challenge, I would say. Yes.
So we discussed your career, your tenure. So in which year you did join the NNF?
I joined NNF in 1992. One fine morning, Dr. D.K. Kua, who was the president of NNF at that
Hmm.
time, and he was senior consultant in our department of pediatrics at Cecil John Hospital, he wanted me to sign the admission form for membership form for the NNF and deposit the fee.
Okay.
So I deposited the money to the NNF office, and how this is how I became the member. So at that time, Dr. D.K. Gua was the president, I can recall, and Dr. V.K. Paul was the secretary. Yes, I remember. Yes, now.
How large was the NNF office building and the membership strength at that time when you joined?
I can say that it was less than 1,000 because my membership number is 758, I think.
Okay.
So it was less than 1,000.
Hmm.
It was a small organization, still growing.
Yes.
But later on, more members they came in, and I would like to tell you that those who started NNF, they were very visionary.
Yes.
They did not restrict the membership to doctors only.
Yeah.
So nurses could also become the members. This still the case.
Yes.
So in 750, there were many nurses who were working in the neonatal unit. So those who were interested in the neonatal care. So it was small but growing. Yes.
So you opened the door for NNF for all, and that's nurses are truly the backbone of
Yeah.
neonatal care.
Yeah.
We all know. Uh, Sir, could you en- enlighten us with the major luminaries or major personalities during your tenure when you joined and when you started working in the
Yes.
NNF?
Yeah.
Yeah.
Dr. Ramesh, this story is very fascinating actually for any organization, how it was formed and how it worked actually.
Yeah.
Rather, the saga of a group of proactive pediatricians, because all of them were pediatricians,
Hmm.
they were concerned with the dismal state of neonatal health in our country.
Yes.
And they came together and established the National Neonatology Forum, NNF.
Sir.
And they worked for the upliftment of newborn care in the country. Um, I would like to name some of them, and there were many others. I'm not able to uh, uh, recollect all the names. Professor Dr. S.K. Bhargav,
Sir.
Dr. O.N. Bakku, Dr. S.J.M., Dr. Simin Irani, Dr. Meherwan Singh, Dr. D.K. Guha, Dr. Shashi Wani, Dr. Anil Narang, Dr. Sudarshan Kumari, and many others. They actually started the organization.
Hmm.
They started from the scratch because there was
Yes.
nothing
Yes.
related to newborn health in our
Totally
country.
agree.
They elected the office bearers who formally registered the organization. They wrote the constitution and defined its priorities.
Sir.
After its formation, NNF prepared the first sets of recommendations for the neonatal care in India, and it was in 1980.
Yeah.
Under the leadership of stalwarts like, as I mentioned, few names,
Yeah.
they played a crucial role in improving the newborn care in the country
Sir.
through their contribution in policy making with the government, program implementation with the government, guidelines development, research, education, advocacy, and curriculum development, and medical and nursing teaching, capacity building in various aspects like resuscitation, newborn transport, care of preterm babies, newborn equipments, etc. So it was a kind of establishing newborn care related to education and related to everything related to newborn care from the scratch in our country. And this group actually started it. And that was continued as more people came into fold and they became the office bearers, and it is
Yes.
still
That
continuing.
still continuing.
Yes.
Yes. So, sir, please now tell us about how frequently and for what duration initial conferences or meetings were held. Any specific events
Yeah.
during that time?
Yeah. Yeah, apart from having meetings for developing the policy documents and subject related meetings, there used to be annual conventions, and they
Yes.
used to be for 2 days,
Okay.
preceded by a day for pre conference CMEs and one day for workshops on important issues. The inauguration used to be on the evening, in the evening on the day preceding the conference, so that we do not lose precious time on the morning of the conference itself. And I think that practice is continuing
Yes.
uh, till now. So this is how, I mean, and there were a lot of trainings
Yes.
happening because
Yes.
when we adopted NNF adopted uh, NILS program, so there
Hmm.
used to be many training workshops for NILS program in different parts of the country for faculty trainings, and then the providers training. So they were happening. Then on various programs like transport, so there used to be many training programs, and then for district newborn care program, which we were implementing for the Ministry of Health and Family Welfare with the support of UNICEF. Uh, a lot of training workshops were happening in different parts of the country at the district level to operationalize the equipment which is supplied by the government of India, and to train the pediatricians and nursing staff working there in the use of those equipments. So all these things were happening during my tenure also.
So we can make out that in the NNF, we are not only learning about saving the newborns, we are also learning about the saving the money and saving the time. As you said in the inaugural time of, so we are always concerned about the time, money, and newborns.
Yeah,
Sir, what was the role of NNF in policy making in initial 20 years? If you can recollect.
yeah, yeah. So whatever I could learn from my seniors, and whatever during my tenure I could look into the papers, I can say that it was very substantial.
Yes.
As I told you that the group who started NNF, they started from scratch. So there was no concept of separate newborn care in our country. There were no even newborn was considered as a part of the mother. So
Yes.
there was no allocation of different the separate bed.
Yes.
So, and since there was no separate bed, so there was no separate allocation, financial allocation in the hospitals for the baby. Uh, it was so we can say that it was rather the concept of a neonatal care was almost known, existent. There were denial of dedicated physical space for nurseries and NICUs and equipments. The appropriate investigative facilities such as biochemical, microbiological, pathological, or radiological were not available.
For
We
the
were never
newborns.
know. We did not know the norms.
Yes.
What are the normal limits of these?
Yes. Yes.
So all these things were there, and NNF worked very hard to establish those norms. Then there was a shortage of professionals trained in pediatrics and newborn care.
Yeah.
Doctors, nurses, and paramedical workers, including community health workers,
Sure.
to provide rational newborn care. Then basic demographical and vital statistics data on birth or mortality rates, prevalence of causes of morbidity, and
Yes.
mortality such as asphyxia, infection and respiratory distress, and low birth weight, they were missing.
Yes.
So, in fact, NNF, with collaboration with ICMR, established a registry. We called it NNPD, Neonatal Perinatal Database.
Yes.
So we NNF collected basic data from our country on all these
Yes.
morbidities. Then also majority of deliveries in the country in 80s and 90s were occurring at home.
Yeah.
Without the assistance of a trained and skilled birth attendant. Neonatal mortality was very high.
Yes.
Prominent causes being prematurity, birth asphyxia, infections, and neonatal tetanus. Neonatal tetanus was also a cause of mortality at that time.
Yes.
And enough advocacy with the Ministry of Health, Government of India, then led to formation of the task force on minimum perinatal care, and it was in 1982. And this resulted in perhaps first ever official government document on newborn care called minimum perinatal care. This document elaborated and recommended delivery of newborn care at three levels: level 1, 2, and 3, the levels which now we know as level 1, 2, and 3. It came in 1982 when NNF developed that document for the Ministry of Health. And that is primary, secondary, and tertiary care. The location of these care areas, the training and the educational needs of medical nurses and paramedical workers, the physical space and equipments needs, and priority areas for research. So everything was included in that document, and that document actually helped both the Government of India and NNF to develop their programs and implementation of those programs. Then NNF also recognized the need to have community and home-based newborn care, documented newborn care practices in community, published reports with recommendations for the government to act like traditional practices in neonatal care, primary care of the newborn, and developed teaching aids for training of community health workers. In the hospital, to ensure the quality and standard of care for newborn, NNF developed teaching aids for medical and nursing personnel working there and established the process of accreditation of the neonatal units.
So,
Realizing that birth asphyxia was a major cause of neonatal morbidity and mortality, NNF adopted American Heart Association and American Academy of Pediatrics Neonatal Advanced Life Support NALS program in 1990, developed its faculty at all the levels, and conducted training workshops for the providers. So this is how the asphyxia was addressed. NRP was later included in various child health programs.
yeah.
It was rechristened as NRP, and it was included in various child health programs, newborn health programs of Government of India. So it became a certain part of these programs, and this is how the neonatal advanced life support, and later on called NRP, it was disseminated at all
All
the
the
levels in
levels.
our country. Yeah.
Thank you, sir, for showing so many illustrious journey. Could you recollect some watershed events, maybe good or bad, during NNF's life or your tenure?
Yes, Dr. Ramesh, there were several good moments, and I can recollect some of them, like having a permanent office space and
Yes.
address in 2004, launching of neonatal advanced life support program in 1990, inclusion of NNF recommendations of essential newborn care in
Yeah.
the Child Survival Safe Motherhood CSSM program of Government of India in 1992, operationalization of essential newborn care in 80 districts of the country under RCH1.
Yes.
Government of India accepting NNF recommendation of observing the newborn week during November in 2000. NNF assisting the government, WHO and UNICEF in adapting the integrated management of childhood illness IMCI to Indian situations and rechristening it as IMNCI. NNF contributing to the design of the second phase, that is 2003 to 9 of the reproductive child health program RCS2. Then NNF affiliation with the International Pediatric Association, indexing of Journal of Neonatology in the MBS database. So these were few things which I could recollect
It's good.
quickly. And as far as bad are concerned, I am not sure.
So,
Yeah.
so
So
we are away from the bad things, and
yeah,
we didn't pursue them.
yeah,
And just keep on working and saving the times.
yeah,
Okay. Sir, could you just tell us since when we are making some specialized committees in the NNF?
yeah. Well, Dr. Miss, various committees they were constituted from the early years of NNF. During my tenure as the secretary, there were several committees. Most of them were working from before I became the secretary, and they were chaired by senior NNF members.
Yeah.
Like the most important committee was steering committee, chaired by Dr. S.K. Bhargav, publication committee, chaired by Dr. Owen Bhakku, perinatal committee, chaired by Dr. Simin Irani, curriculum committee, chaired by Dr. V.K. Paul, equipment committee, chaired by Dr. A.K. Devrari, research committee, chaired by Dr. Anil Narang, accreditation committee, chaired by again Dr. Anil Narang, and industry committee, chaired by Dr. N.B. Mathur. So there were few more, but I can recollect these important
Yeah.
committees. So all of these committees they used to have more members, co-opted members, and they used to develop recommendations, and they used to have meetings
Yeah.
to discuss their recommendations, and they used to submit those recommendations to NNF Secretariat, and those recommendations used to be further discussed in the first in the EB meeting, and then if required in the GPM
GP.
meeting. So yeah.
So that was a really difficult time to sit all together, senior persons, spare time, and formulate the guidelines as
Yeah.
per the international norms.
Yes.
And still, we are going through the documents.
Yeah.
So that was great because that was not the era of Zoom and we can
No,
have meeting
yes, yeah,
sitting
they were all
all
physical
apart.
meetings. Yes,
Yes.
yeah, yeah,
So there was intense physical
yeah,
efforts,
yes,
traveling,
yes,
sparing
yes,
time from the work. That was
yes,
the great. Thank you.
yes.
So, sir, you were telling about the NNF guidelines. Can you just recollect since when we started making clinical policy documents in NNF and what documents and guidelines evolved? What was the perceptions while the translating guidelines in the practice?
Yeah. As far as guidelines, recommendations for care is concerned, they were developed right from the beginning. As I told you, there was one minimum perinatal care document. Then there were recommendations for primary newborn care.
Sir.
There were recommendations for traditional practices in newborn care. But as far as clinical practice guidelines are concerned, the first NNF practice guidelines, they were developed in 2011, and then the evidence-based evidence-based guidelines, they were published the first time in 2020, and then that process is still going on, and we are adding new subjects every year. So there are grade-based, evidence-based practice guidelines are now available, which were developed by NNF. So yeah.
So the guidelines are since beginnings. We started with guideline and still working on that. So what about the collaboration with like Government of India and other international agencies? Uh, what was the
Yeah,
trend?
yeah. Well, as I told you that we worked very closely with all these agencies,
Yeah.
and these collaborations, they actually resulted in major impact on neonatal care in India. NNF started collaborating with the Government of India right from the beginning, and that first document was developed in 1982, which actually guided the newborn health programs, policies later on in our country. Then UN agencies like WHO and UNICEF to develop programs, to implement programs like district newborn care program. Since NNF's inception, we are working closely with IAP. The programs, child health programs like Child Survival Safe Motherhood Program, RCH1 and RCH2, the District Newborn Care Program, the Facility Based Newborn Care Program, the Neonatal Perinatal Database, the NILS, NRP, etc. All these programs were basically conceived and implemented with the help of either government agencies or the UN agencies. So, NNF has always contributed to, the newborn health, newborn care in our country in collaboration with the agencies who are actually doing this work. Yes.
So that was great how to collaborate with the government and how to formulate the guidelines, how to save the time, how to save the newborns, how to save the funds. Could you tell me about equipment status during your start journey time? What was the available
Yeah.
facilities and
Yeah.
all the things?
Yeah. Well, that's a very good question, I think. In 1980s and 1990s, even in the first half of 1990s, the neonatal care equipments which we used to have in our units, most of them were imported equipments,
Okay.
which were very costly. Their maintenance was very difficult, and they were not designed according to our local
In Indian
needs,
needs.
Indian needs.
Yes.
Say, for example, our electricity supply is different, and uh, they were designed and manufactured according to some other needs.
Yeah.
Um, NNF recognized it and established an equipment committee which adapted specifications according to our needs, our situations,
Yeah.
and our available infrastructure. And NNF did one good thing was that NNF worked with the local manufacturers
Yes.
to develop Indian version of equipments. And the NNF's efforts, they were reflected in availability of India-made neonatal care equipments, from resuscitation bags to sophisticated neonatal ventilators now. So now almost everything which we need in our neonatal units, it is being developed by Indian companies. So this has been a long journey, and NNF has been an active partner in developing these equipments.
So
Yes.
that's really great, because nowadays when we work in the NICUs and from the level 1 to level 3,
Yeah.
so most of the equipments they
Yeah.
are make in India
Yes.
by the Indian companies, by
Yes.
the Indian
Yeah.
manufacturers,
Yeah.
and so many times they are readily available to help us on site.
Yes.
So that's really great.
Yeah.
Uh,
Yeah. I can give you an example.
Certainly.
Say some of the equipments which we used to have at that time. Say if you can recollect, you used to have one FiO2 monitor.
Yeah.
That was the probe used to be placed in the head box.
Mm.
What FiO2 wave is receiving, because at that time we were not even having blenders,
Yes.
so we were not able to know
Making
what
charts
is the
and
FiO2. Yeah, making the charts. Now we don't need FiO2 monitor, because now we have blenders and we exactly know what
what we are giving.
percentage of oxygen we are
Yes.
giving to the new one. So things have changed. Then in between, and the CPAP machines which we now have, the bubble CPAP machines, they were not available actually.
Yeah.
So even for giving CPAP, we used to use the ventilators.
Yes.
We used to intubate the baby and ventilating the babies. So now things have changed, because now Indian made nasal CPAP machines, the bubble CPAP machines are easily available, and that has made our task very easy actually. Yeah.
Really enthralling me to listen your time's journey, and I think that not only saved so many newborns, but initial vision of having indigenous equipments, indigenous norms for the equipments,
Yes.
local guidelines that are practically transferable to the our newborns. So
Yes.
that only not only saved newborns, that
Yes.
is still saving the national exchequer.
Yeah.
As nowadays we see that most of the equipments in the NICUs
Yeah.
from the level 1 to level 3, they are made in India,
Yeah.
made by the Indian hands,
Yeah.
they're made by the Indian owners.
Yes.
So I think, and they are certainly world class nowadays.
Yes.
So I am really, we are thankful to our
Yeah.
visionary earlier leadership.
Yeah.
They conceived the idea that we have to work upon that as well.
Yes. Yeah. Ye-
S-
Yeah.
Yeah.
Yeah. Yeah, I certainly agree with you, Dr. Ramesh. The initial leadership of NNF, and then later on, the legacy continued actually. And the NNF, the newborn care, which was non-existent in our country in 70s and 80s, we started from there. And in 40 years of time, a little bit more than 40 years, now you can see that we are self-sufficient as far as the newborn care services are concerned. We have a number of level 3, level 2 units. We have the SNCOs in every district now, and we have equipments, indigenous equipments. We don't have much problem in maintenance of these equipments. We have protocols available to us for treating various newborn ailments.
Yes.
We have clinical practice guidelines, and we have a lot of branches all across the country, the state branches and
Even
other
abroad.
branches, yeah, and even abroad. So now the membership has gone beyond 10,000 now, more than that. So more and more people are coming to the fold of National Unitology Forum. Now we have procured another office space in Delhi.
Yeah. Yes. I
So
learned.
yeah, so and we are having successful national conventions. We are having regional conferences.
Yes.
We are having state conferences. I can recall and earlier the NNF state branches were not there in each state.
Yeah.
So many states they were establishing NNF branches. I can recollect in 1997, I think, Rajasthan NNF branch was started. The first convention was in Jodhpur. I participated in that convention. Dr. Mukesh Gupta was the first president of NNF Rajasthan. So likewise, in during my tenure also, we persuaded many states to adopt NNF's work and start state branches there. So this is how NNF's journey has been, and I must say that this journey is very satisfactory. I can tell you that in 2009, I think, uh, other than 2004 document in the Japago compendium, um, Dr. Bhargav, myself, and Dr. Harish Chelani, we again documented the history of NNF, and it was published in the Journal of Neonatology. So that article again um, documented everything till then. But even after 2009, a lot of things have happened, and they are still happening. So now newborn care in our units is more safe.
Yes.
It's more successful. We are able to save more babies with intact survival, and concepts are changing. We are adopting new things. Now we are having a lot more young neonatologists doing DMs and DNBs. So things have changed actually, and NNF has contributed significantly to this growth, and that is a very satisfying thing for any professional organization. So I would say that NNF has done a great job. Yeah.
तो सर एनएनएफ ने गवर्नमेंट के साथ गाइडलाइंस बनाई, खूब सारे कोलैबोरेशंस किए। गवर्नमेंट ने अपने को रिकॉग्नाइज करने के लिए कभी टिकट्स रिलीज कर देती है, कभी कुछ अपने को संस्थानों को भी कुछ पद्मश्री अवार्ड्स देते हैं। अपने एनएनएफ के साथ कभी कुछ ऐसा हुआ?
Yes, I think one recognition was there in the year 2000,
Yeah.
when NNF, the government of India accepted NNF's request to hold an official newborn week. So this has been continuing till now. Second thing which I can recollect is uh, Department of Post of
Yeah.
Government of India released a first day cover for newborn week.
Okay, great.
Yeah, it was in 2003, and and the theme that year was on hypothermia. So it was depicted on the first day cover. It was released during the advocacy and partnerships meeting in during the newborn week in November 2003 in Delhi. It was released by the Secretary, Minister of Health, Family Welfare, Government of India, and the Postmaster General of North Region, I think,
Yeah.
of Department of Post in New Delhi. So these two things happened, and before that, I think one postage stamp was also released on newborn care, and that was also done by the Department of Post. Uh, the individual awards, I'm not private. I mean, I don't have any information as such. But one name which I can tell you is Dr. Neelam Clare.
Yes.
She got the Padma Award
Okay, great.
later on. In fact, I worked with Dr. Neelam Clare when she was the secretary. I used to be the joint secretary and treasurer, so I worked very closely with her. So
Okay.
that was one thing, and many more people must have received, but I don't have the information available to me at this particular moment of time. Yes.
सो थैंक्स सर। मेरे साथ थे डॉक्टर जेपी दादीच सर। अभी हम दोनों जयपुर में हैं। सर अभी प्रेजेंटली जयपुर में रुक्मणी बिड़ला हॉस्पिटल में काम करते हैं, और आज हमने सर के साथ एनएनएफ की सर की जर्नी, सर की एकेडमिक जर्नी और सारे खट्टे मीठे अनुभवों को साझा किया। और इसके लिए हम एनएनएफ की प्रेजेंट लीडरशिप को भी धन्यवाद देते हैं कि उन्होंने एनएनएफ लेजेसी सीरीज वीडियोस के नाम से ये प्रोजेक्ट शुरू किया है, जिसमें मिड लेवल का मेरा जैसा एनएनएफ का वर्कर, सीनियर पुराने एक्सपीरियंस लोगों के साथ बैठ के कुछ ऊर्जा, कुछ एनर्जी, कुछ विजन, कुछ शेयर्ड मोमेंट्स को शेयर करते हैं। सो सर, इसके अलावा आप कुछ और बताना चाहेंगे?
I'm really happy that NNF, as I said in the beginning, that I'm really happy, and I appreciate the present leadership of NNF for thinking about this project and now implementing this project.
Sir.
And I believe that many other stalwarts have been interviewed,
Yeah.
and that will be available to the all the NNF members. That those interviews will be in public space, and they will be very inspiring to the people working in newborn care in our country and even beyond our country. So again, thanking the NNF leadership. I think it was a good experience, and I must thank you again for
Thank you.
this wonderful interview.
Sir,
You asked many questions. I thought that whether I will be able to answer those questions or not, but you asked
we
the
are
questions
not
in a
only
very,
enlightened but
yeah,
also
yeah,
energized.
very simple way, and I hope that I answered your questions correctly. Yeah.
Phoenix. Enabling life.